So, hello everyone. So, today we continue the yesterday's topic only, chapter 19. Okay, and yesterday we saw learn about how to code fractures, right? Different types of fractures and how to code them, different guidelines for fractures that we already see. I just give you quick review about it and then start for teaching you how to code burn. Okay. So fracture, in case of fracture, we have two types of fracture, open fracture and closed fracture. If closed fracture is there, we have to see the encounter, okay, not encounter, treatment, type of treatment. If active treatment is there or initial encounter is there for particular fracture, in that case we have to use A as a seventh character, okay. Then subsequent routine healing, we have to use D. Subsequent delayed healing, G is there. Subsequent non-union, we have K letter. Subsequent malunion, we have B letter. And for sequela, we have S letter. And if the fracture is open, in that case, we have to see what is the type of, if fracture is of type 1, 2 or it is not specified. In that case, we have to use B for active treatment, E for subsequent routine healing, H for subsequent delayed healing, M for subsequent non-union, Q for subsequent malunion, and S for sequela. And if the fracture type is 3A, 3B, or 3C, any from type 3, open fracture type 3 is there. In that case, you have to use 7 characters C for active treatment, A for subsequent routine healing, J for subsequent delayed healing, N for subsequent non-union, R for subsequent malunion, and S for sequela. So please remember this. You will get this same flowchart in your ICD book only. Okay, make sure that you refer that when you selecting your course. Okay, read your reports or your question carefully and then go and select for fracture and assign proper and correct 7 characters. So these are the questions. We already completed this one. This is how you have to highlight when you solving the questions. Okay, for CPC examination. The main term you have to highlight. Like here, right scaphoid fracture is there, you have to highlight this or you have to underline it. So whatever is easy for you. Okay. Here, displaced malleolar fracture, trimalleolar fracture of leg, left leg, lower leg, and that to type 1 with delayed healing. So these are main terms. Those you have to highlight. So it will be easy for you to search for the code. So now we'll start with our next point, coding for burns and corrosion. This is very important point regarding your CPC examination. Okay, because you will get most of the question on this chapter or when you need to search ICDs for. Okay. So what is burn and what is corrosion? Can you tell me difference between these two?
A burn means
Yes.
it's because of the fire. Corrosion, I don't have any idea about this corrosion.
Okay. So burns caused because of any heat source. Okay.
Yes.
Thermal or anything, fire or any electric shock. So anything. And corrosions are caused because of chemicals. Okay.
Okay.
So we have 3 types of degrees of burn. Coding guidelines for burn and corrosions are there is no difference, but we have different codes for it. Okay, guidelines are same, but we have different codes. So we have first degree burn, second degree burn, and third degree burn. Okay, and we have separate codes for different degrees, and that's why we have so many guidelines to follow. So ICD-10 makes a distinction between burns and corrosions. Okay. The burn codes are for thermal burns except sunburn. Sunburns we code with category L55. Please remember this. This is very tricky question. Sometimes they ask question on sunburn, ask you to code sunburn. They will give you degree of sunburn and you have to select the correct option. They will give you option like normal code for normal burns also and L55 category codes also. Okay, so you will get confused between them. But sunburn we have to code with category L55. Please make a note of it. That's why I have highlighted it. Okay. So burn codes are for thermal burns except sunburn. Sunburns we code with L55 category. Okay. Thermal burns that come from a heat source such as a fire or hot appliances. Okay. The burn codes are also for burns resulting from electricity and radiation. And corrosions are burns due to chemicals, and the guidelines for burns and corrosions are same. This is clear?
Yes, yes.
So current burns coded with T20 to T25 category. Okay, any code from T20 category to T25 category. Okay, are classified by depth, extent, and by agent. If agent is known or agent is mentioned, we have to use X codes to code that agent. Okay, and burns are classified by depth as, let's see here, first degree burn, second degree burn, and third degree burn. Just a minute.
I don't understand this first point. The current burns by agent, like this one.
Okay. What happened?
I don't understand that point.
Okay. So if current burns are there, we have to code them using T20 to T25 category. This is category for burn. Okay, burn. For injury or fracture coding, we have S category, right? Like that?
Yes.
Yeah.
Yeah, I understand.
This code starts with T category, T20 to T25. You will get code for burns in this category. From this, you will not get any code for burn. Okay. Are classified by depth, extent, and by agent. Okay. So these codes are classified by depth and extent. Like fracture codes, we get code for specifications like laterality, anatomic location, and all.
Like that?
Okay. So burn codes we have classified by depth and extent. Clear?
Yeah, okay.
This is extent. Extent means degree. So first degree burn, I'll explain that. First degree burn damage the outer layer of skin means epidermis, right?
Yeah.
Okay. So first degree burn damage the outer layer epidermis of the skin, and also known as this condition is also known as just redness will be there. Then second degree burn, this picture indicate blistering with damage extending beyond the epidermis, partially into the layer beneath it, means still dermis. It will damage still dermis. You can see here. The second layer is also damaged.
Mesodermis.
Yeah. Then third degree burns indicate full thickness tissue loss with damage or complete destruction of both layers of the skin, including hair follicles, oil glands, and sweat glands. You can see here, third degree burn. It extends till third layer, right? All the above two layers get destructed. Clear this much?
Yes.
Burns of the eye and internal organs, you will get code from T26 to T28 are classified by site but not by degree. Okay, so these burns are for outer organs, for mostly for skin, related to skin means for hand, legs, face, back, or your stomach. Okay, you will get code from category T20 to T25, but if burns for eye or any internal organ is there, in that case you have to code it from T26 to T28. You don't need to remember these categories. You will get these codes in this category only. Okay. Your alphabetic index will guide you accordingly. You just have to follow the instruction alphabetic index and tabular index give you. Classified by site but not by degree. Like this one. Skin related burns we classified by depth and extent. Extent means degree and extent. But burns of eye and internal organs are classified by site, not by degree. Clear?
Yes.
So we'll see now guidelines. Sequencing of burn and related condition codes. Sequence first the code that reflects the highest degree of burn when more than one burn is present. So highest degree is, which is highest degree?
Third degree.
Third degree. Right. So A point, when the reason for admission or encounter is for treatment of external multiple burns, sequence first the code that reflects the burn of the highest degree. Means if third degree and 2 degree is there, second degree is there, we have to code first third degree codes. Okay. Then when a patient has both internal and external burns, internal organs also damaged and external burns are also there. In that case, the circumstances of admission govern the selection of the principal diagnosis or first listed diagnosis. Okay, because external burns we code with extent and degree, right? Depth and extent. But internal burns we code with site.
Yes.
Right? That's why it depends on circumstances, reason for encounter. Then next point, when a patient is admitted for burn injuries and other related conditions such as smoke inhalation and or respiratory failure, the circumstances of admission govern the selection of the principal or first listed diagnosis. Okay. In both the cases, same guideline is there. Circumstances of admission means reason for admission governs the selection of principal diagnosis, because we need to sequence this course. In medical coding, we need to sequence the course we are assigning, right? So it is very important. The first code is the main reason for encounter. Clear this much?
Yes, yes.
So next point, burns of the same anatomic site. Classify burns of the same anatomic site and on the same side but of different degrees to the subcategory, identifying the highest degree recorded in the diagnosis. For example, for second and third degree burns of right, okay, if second and third degree of right thigh means same side and same side, laterality also same and side is also same, means anatomic side thigh is same and right side is also there, and it has second degree burn also and third degree burn also. In that case, you have to assign code only for third degree, correct?
Yeah. Yes.
So you T24, 324 point. No, it is better that I'll go by this. I'll show you how to find the code for burns. So we have to select this burn. We have different terms, brush burn, burnout, and everything. But we have to select this. The burn, electricity, flame, hot gas, liquid or hot object, radiation, steam, and thermal. Okay, so this is burn, abdominal, depends on different site, and you can see here first degree burn, second degree burn, third degree burns. Okay, each and every side has different code for different below elbow. So now
Right.
it's clear. So we don't have separate code for separate. We can code use two codes for same side and same lateral. Okay. So if forearm is there, left forearm is damaged with second degree burn and third degree burn also, we have to code only third degree. Highest degree, we have to keep same side and same laterality is there. Okay. Any doubt?
No, I'm clear. Good.
Yeah. So next point, non-healing burns. Non-healing burns are coded as acute burns. Necrosis of burned skin should be coded as a non-healed burn. Okay, if non-healing burns are there, you have to code it as acute burns. Acute means normal burns. And if necrosis of burned skin is there, you have to code it as next point, infected burns. For an documented infected burn site, use an additional code for the infection. If burn infection is there, you have to code that infection additional. Means after coding for burn, you have to add a code for infection also. Next point, assign separate codes for each burn site. When coding burns, assign separate codes for each burn site. Category T30, burn and corrosion, body region unspecified should rarely be used. Okay. Codes for burns of multiple sites should only be assigned when the medical record documentation does not specify the individual sites. Okay. If medical documentation does not specify between individual sites, just a minute. Okay. So if our medical documentation does not specify between individual site, in that, but multiple sites are involved, in that case we can use burns of multiple sites code. Okay. And when coding for burn, assign separate code for each burn site. So this T30 you saw here first. This is by default, which is right after burn. Okay, this is called default, which you find right after main term. Okay, T30. You cannot, in most of the, in rare cases, you have to use this code. Most of the cases, site will be given to you, and you have to code according to that site. You have to assign separate codes for each burning site. Just remember that if the same site and same laterality is affected with two degree means two types of degree, okay, you have to code highest degree for that particular site. So next point, burn and corrosion classified according to extent of body surface involved. Assign code from category T31 burns or T32 corrosions classified according to extent of body surface involved. Okay, for acute burns or corrosions, when the site of burn or corrosion is not specified, or when there is a need for additional data. Okay, it just mentioned like 27% of body surface area is burn, but site is not given. In that case, you have to use this course, extent of body surface involved. I'll show you how to select this course. Okay, but you have to use this course when site of burn or corrosion is not given to you. Just percentage of total body surface area is given to you, or if sometimes additional data needed, in that case you have to use this course. In the same burn term, you have to go down and search for extent E. You can see here. Please note down these steps. In the alphabetic index, you have to search for burn and then search for extent, percentage of body surface. Okay. Here you can see 10 to 19% of total body surface. Okay. With 0 to 9% third degree burns. See how these codes are arranged. 10 to 19% total body surface with third degree burns. Some percentage given for third degree burn also, like this. We have till 90%. 90% or more body surface area, total body surface area with some percent of third degree burn. Clear? Any doubt? You can ask me. Because
No, I got it.
Use category T31 as an additional code when there is a third burn involving 20% or more of the body surface. Just we saw codes for extent of body surface involved, right? So it divided as total body surface and then again some percent of third degree burn. Okay, so if third degree burn involving 20% or more of body surface, in that case you have to use additional code for T31 from category T31 with normal burn codes. Okay.
Okay.
Now, rule of nines. Category T31 and T32 are based on the classic rule of nines, is estimating body surface involved. Head and neck are assigned. You can see here. This is percentage for body surface involved. For head, we have 9%. For each arm, we have 9%. Okay. For each leg, we have 18%. For posterior term, we have 18%. And for back, we have 18%. And for genitalia, we have 1%. This is how they code for percentage of burn, extent of burn involving body surface. Providers may change this percentage assignments where necessary to accommodate infants and children who have proportionately larger heads than adults, and patients who have large buttocks, thighs, or abdomen that here in case of infant, head and neck area consists 18%, both arms 9%, that is same. Just head and legs have different percentage. You don't need to remember these things. You'll get everything in your book only. Mostly provider will provide you percentage. You just have to select correct code for it.
What this percentage determines?
Total body surface area input. This is, you don't need to calculate anything from this. You just have to remember. Sometimes you will get a straightforward question on it. What is rule of 9? Or even when you go for interview, they will ask you about this. Okay, just you remember this percentage. For head 9%, for both hands 9%, for legs 18%, and back and front also 18%. That's it. Okay. Other things provider will give you. You just have to select correct options. Correct code from it. Clear? So next point. Encounters for treatment of sequelae of burns. Encounters for the treatment of late effects. Sequelae means late effects. So late effects of burn or corrosions, that is scar or joint contractures, should be coded with a burn or corrosion code with the 7th character S for sequelae. Okay, 7th character S is present in burn and corrosion codes also. So if sequelae is there, any late effect is there, you have to use 7th character S. Sequelae with a late effect code and current burn. If sequelae effect is also there, plus means late effect is also there, plus current burn is also there. In that case, what to do? We'll see. When appropriate, both a code for current burn or corrosion with 7th character A or D. Okay? A for initial encounter, D for initial encounter or active treatment, and D for healing or subsequent encounter. And a burn or corrosion code with 7th character S may be assigned on the same record when both a current burn and sequelae of an old burn exist. If both conditions exist, we can use A and D 7th character also, A or D 7th character, and also we can code S as a 7th character for late effect. If the current burn and sequelae of old burn, both conditions exist. Burns and corrosions do not heal at the same rate, and a current healing wound may still exist with sequelae of healed burn or corrosions. This guideline is because burns and corrosions do not heal at the same rate, and current healing wound may still exist with sequelae of healed burn or corrosion. Use of an external cause code with burns and corrosions. An external cause code should be used with burns and corrosions to identify the source and intent of the burn, as well as the place where it occurred, like fracture, injury. With burn also, we have to use external cause codes to identify intent of burn as well as place. Okay, and if activity is there, we have to use activity code also. So again, while coding burns, you have to remember these things. Burns are coded based on several factors. Location you will find category D22, D25. Your first listed code will be a combination code that reports both the site and severity of the injury. Injury or okay, I'll make add in burn term here. So your first listed code will be a combination code that reports both the site and severity of the burn. A separate code is reported for each burn site. Next, degree of the burn. First, second, or third. When there are multiple degrees of burns in the same location, same 3 character, okay, like this. T20 or T25. Code the highest degree burn for that location. When coding multiple degrees of burns in different locations, sequence the code for burn of the highest degree first. Okay. In case of sequencing, you have to sequence highest degree burn first. Okay. And if multiple burns of same location, same site is there, in that case also you have to use code for highest degree burn only. And third point is total body surface area. TBSA, also known as TBSA, total body surface area. The total body surface area affected by the burn, a code from category T31, is used when the site is not specified to record the burn mortality, or when when there is mention of third degree burn involving 20% or more of the body surface. This is just quick review of those guidelines. Okay, so TBSA codes, T31 codes, category T31, we have to use when there is no specification of burning site. Okay, or burn site is recorded, or in that case, when third degree burn involves 20% or more than 20% of total body surface area. Okay. The rule of 9 assign percentage to each body area to assist you coding the TBSA of burns. Okay. When you reporting burns, when you code for burns, you have to remember these steps. You need at least 3 codes to properly report burn diagnosis. Okay. First listed code, site and severity. Remember these steps. Okay. First listed code will be for site and severity from category T20 to T25. Your first listed code will be a combination code that reports both the site and severity of the injury. The description of codes in T20 to T28 range are first defined by anatomical site of the body affected by burn or corrosion. Okay, so first 3 letters are depend on anatomical sites. This first 3 letter T20 or T21, T21, T10, 22, T23 till T28 are depends on anatomical location affected by the burn or corrosion. Then fourth character for each category identifies the severity. Okay? Except categories T26 to T28. These categories for internal burn or burn of using the layer of the skin. The severity of burn is identified by degree. So fourth character is depend on degree of the burn. And fifth character reports additional details regarding anatomical site of burn. And sixth character reports laterally. Show you. Suppose this will take example of, you can see here, colon is internal organ, right? So it has only one code, T28.2. There is no separation of degree, right? In case of chin, we have separation, first degree, second degree, third degree.
Okay.
Click here. It is better if I show you. So this is calf. Okay. We have separate. You can see here. It starts with T24 category. Okay. Then first degree we have 139. Okay. And if laterality is mentioned there, we have separate code for left calf, for right calf. This fifth character represent laterality. 2 here is mentioned for left, 1 representing right. Clear?
Yes, yes.
And this fourth character represent here. 1 represent first degree, 2 represent second degree, third degree represent by 3 characters. So this is how, yes, read it out.
I got it, yes.
So this is about your first code, okay, which you need to assign first. About all three characters. First 3 character depends on anatomical location. Okay. Then fourth character identifies severity or degree of burn, except for categories T26 to T28, which is for eye and internal organs. Fifth character for additional details regarding anatomical site, and 6th character is for lateral. And seventh character obviously A, D or S. So second, which you need to sometimes if multiple codes are you need to assign multiple codes from this category only from T20 to T25 if multiple sites are involved. Okay, but after coding this, you have to assign code for E for extent from category T31 or T32. T31 is for burn and T32 is for corrosions. So burn and corrosions are classified according to extent or percentage of body surface, total body surface area involved, TBSA. Code T31 for burn and T32 for corrosion based on the classic rule of 9. The rule of 9 for adult patient assign 1% of TBSA to the genitalia, multiples of 9% of other body areas. 9% head, 9% per arm and 18% per leg etc. That we already see. Modified rule of 9 is applied for infants to account for their relatively larger, it's 18% and smaller legs, it's 14% each. The required fourth character identifies the percentage of body's entire, patient's entire body affected by the burn. The fifth character identifies the percentage of the patient's body that is suffering from third degree burn or corrosions only. Okay, so fifth character represents third degree burn or corrosion. So you will this course. How to find this course? Remember? Can you tell me?
So if you take this one, right, T24.031, in that
No, I'm asking you this course about this code. Code for extent.
code for extent.
Extent of burn. I ask you to note down this word because after using this course, you have to use that code. That will be your next code. Okay, I'll tell you. You have to search for burn. Okay, and in the burn, you have to search for extent. Remember?
Yes.
Yeah. So here are the codes for extent or percentage of body surface. These codes you have to use after using this code. Yes.
Okay, after using this code, we have to use that extent code, is it?
That's why I have included this one. I'm explaining that to you right now.
Okay.
When you reporting burns, you have to first use this codes according to anatomical site and everything. These are steps, different steps.
Yes.
Okay.
I got it.
In this first step, you may need to use more than one course depending on anatomical size and degree. But after
First anatomic code, then extent code, is it?
yeah. So these are the steps. This is first step. This slide represents first steps. It may include more than one code, more than one ICD code.
Yeah.
Okay. From T20 to T28 or T26 to T28. Okay, and after coding this for particular site, you have to code for extent.
Yes.
Getting?
Yes.
Yes. So this is how you can find extent code. Not each and every time you have to use these codes. You have to use this code in this case only. These are the cases. That one. I have already explained this one when there is no mention of site of burn, right? When anatomical site is not mentioned, in that case you have to use this extent code. Or if anatomical site is mentioned, you have already assigned code for anatomical site. That is done. Okay, that is first step is done. But with total body surface area at least 20% and more than 20% third degree burn is present. In that case also you have to additionally use this codes for extent.
Okay.
In case of two scenario only you have to use this code, the second step.
Those two scenarios are, one is unspecified area and second is the 20% above percentage.
Unspecified area, but percentage is given to you. Means total body surface area is given. That I'll show you questions regarding that. But If just percentage is given, total means suppose 50% of TBSA is involved, a particular anatomical site is not mentioned. Then how will you going to select the code for this first step?
Yeah.
That's why in that case you have to use this T31 or T32 code. Or if more than 20% of total body surface area are burned with third degree burn, in that case you have to use these codes additionally.
Okay.
Okay, just give me a minute. I add that point also. You are getting confused between this.
Yes.
Now you will not get confused. I change this as first step. Okay. Hello.
Yes, I'm here. I'm listening. Yeah.
I changed that one. Previously, I just mentioned one here. So I changed that with first step. So your first step will be this, using this anatomical site and everything, anatomical location and everything from T20 to T28 category. Okay. Second step will be extend code for extend, and I have added this point also here. The code from category T31 is used when site is not specified. Okay.
Yeah.
And or when there is mention of third degree burn involving 20% or more than that body surface area. In that case, you have to use this code additional. So I hope this is clear now.
Yes.
Once you did some practice and go through this guideline again and again, you will get familiar. Don't worry about it. As this is your first time, you get confused.
Yeah, it's a little bit confusing.
In CPC, they mostly ask you question on this. They expect you to code ICD for this. So first step. Lastly, code for E for external cause. Okay. External cause to identify the source, place, and intent of the burn. Or if agent is present, you have to code that agent also to identify chemical substance of the corrosion. If this information is present, given to you or in your examination, if they ask you to code this cause or agent, in that case you have to use the codes for external cause and agent. So this is how it will looks like coding of burn and corrosion. The first code will be depend on body site, depth, encounter, and laterally. So suppose T24.211A burn of second degree of right thigh initial encounter. Okay? So our second code or next step will be, this first step may include more than one code. Okay, and after that second step will be T31.10 burns involving 10 to 19% of body surface with 0 to 9% of third degree burns. Okay, and external cause X00 to 3XXA fall from burning building or structure in uncontrolled fire initially, and also same.
So for this, we have to write 3 codes.
Yeah. Examples: a 3-year-old pulls a pot of hot water of the stove and it splashes on his face and arms. When examined, the infant has first degree burns on his lower face, okay, and second degree burns on both arms. See how I highlighted these terms,
Yes.
which are important to find out the course. Okay, the same method you have to follow when you solve your mocks, and after that, in case of when you going to solve CPC examination, you can't do this. It is online. It will be online. So practice like this. Okay. So ICD codes we need to use are T22.20XA for burn of second degree of shoulder, upper arm, except wrist, hand, unspecified site, initial encounter. Then T20.10XA burn of first degree for face. We use this code, and as we have external cause, positive agent, that is contact with other hot fluid, initial encounter. Let's see how to find this course. First, we need to search code for second degree, right? First degree and second degree is there. We have to use first code, highest degree.
Yes, yes.
Okay, that's why we need to search code for both arms second degree. I mean burn term, okay?
Yeah.
I'm searching for one arm. It says burn upper or limb. Upper limb. So like this, okay. See here are the codes for upper limb. Upper limb is your code here.
Second degree.
Second degree burn, both mentioned.
So they mentioned both arm. Which one
Yes.
we should, left or right?
I'll show you. Just a minute. Here, multiple side. Just a minute. I'll show you. See, when we search for upper limb and go down, it says multiple sides. If multiple side, if side is not specified like left, right, in that case we have to use these codes. First degree, we have separate code for first degree, second degree, third degree. But now in this scenario, we have separate means our laterality is given, so we have to use separate codes. For left second degree, we have to use T22 292, and for right second degree 222 291. Okay, I change here. So we need total 3 codes now. 2 to represent both arms, and for first degree of lower face. See.
Here we have to mention the both arms means left and right. We have to give codes.
Yes.
Okay.
If you search for face, it says burn head. Search for head. That's why we need to go and search for head. For head, first degree burn is there. First we'll see T20 10. Yes, T20 10XA. T20 10XA. Burn of first degree of head, face, neck, unspecified side, initial encounter. First degree of face, first degree of head. And lastly, contact with hot fluid. So that we need to go in external cause index and search for contact. Contact, this is accidental contact, obviously. Contact with, contact with hot and then, okay. So, related to assault, suicide, or undetermined whether accidental or intentional, we have said. Right now it is accidental, so we have to use X12. So this is one example. This is second example. The patient who was severely burned is hospitalized for treatment in the burn unit. You can see my screen, right?
Yes, yes.
Treatment in burn unit. The patient is suffering from burns on 36% of his body surface. Third degree burns exist on 27% of his body surface. Which ICD-10 code should be used to report extent of body surface involved? You can see here, there is no mention of anatomical site. They have not mentioned anatomical site. They just mention percentage of body surface involved and third degree burn percentage. So in such cases, we have to use only T31 code, T31 or T32.
Because of unspecified area?
Yeah, because area is not given here. Anatomical site is not mentioned. That's why.
I got.
And as it includes third degree burn, more than 20% of total body surface area. Even though if they have given us documented anatomical site for it, we have to use this code additionally. But right now, here they have not mentioned any anatomical site, so this is the only code we have to use. T31.32 burn involving 32-39%, still 36%. Now can you tell me how I have to go? First for burn. You tell me, I'll select the terms. Next.
Third degree.
Again, you wrong.
Yeah.
Extent. We are searching for total body surface area.
Yes, yes.
Remember, have you noted that point or not?
Yes, I'm doing.
So you have to search for extent.
10% of body.
Very, very important point. Otherwise, you will get wrong.
Yeah, the previous also I did this.
So here 36% is involved. So we have to search 32-39% of total body surface area. And under this 32-39%, we have to search for third degree. Okay, so now we have to follow this third line.
T31.33.
30-39%. Under the 30-39% total body surface area, now we are searching for third degree, which is 27 degree, right?
Okay. So,
27%. Yeah. So 20 to 29% third degree burn. So that's why we have selected this code. T31 to T31.32.
yeah, it's clear.
And I hope you noted this point.
Yes.
So third example, Jake is seen for a second degree sunburn on his back. What are appropriate ICD-10 codes? So for sunburn, we have to code from category L55. I'll show you the direct code for it in stub sunburn.
Only one.
No, not only one code. We have code depending on degree. We have to use separate category for it. For sunburn, first degree, second degree, third degree. Now here second degree is mentioned. That's why we use this code L55 point. Okay.
Okay.
So remember this point. They will treat you. Because when I selected this question, there are options like some options from the normal burn course from T category also. Okay, second degree normal burns are also in options. Two options with T code are there, and two options from L category, L55 category was there. Okay, I hope you have clear now how to code the burns.
Yes, yes.
So should I stop or continue? Because next point will be again lengthy point.
We will stop here.
Okay.
Yes.
So we'll discuss our last point of this chapter 19, which is adverse effects and everything poisoning and all. That we'll discuss in tomorrow's session.
Sure.
Okay. Bye bye. Take care.